All right, so welcome to our webinar, Class Struggle in the Age of Pandemics. This webinar is being put on by the Revolutionary Socialist Network, a network of organizations and individuals working to cohere a revolutionary socialist current in the US on the basis of genuine internationalism and working class independence. RSN affiliates are involved in struggles against oppression and exploitation across the country and are working toward the construction of the mass working class revolutionary party that we need to fight against capitalism. For more on the RSN's politics, please visit revolutionarysocialist.org, where you can find our points of unity, statements by member organizations in the network, and links to articles written by our members. You can also find links to our member organizations and an email sign up to join the network on the website, and a link will also be posted in the chat to our email sign up. We hold twice monthly conferences to discuss politics, share and draw lessons from the struggles our affiliates are involved in, and plan events like this. We'll be launching revolutionary study groups soon and continuing to find ways to coordinate political actions. Sign up on the website or our newsletter for more information. So we're holding this webinar to discuss how the global coronavirus pandemic has exposed the underlying weaknesses of world capitalism. Workers and oppressed people face three interrelated crises: a looming climate crisis, an economic crisis which had been looming previously but now has developed full force, and a health crisis threatening the lives of millions. The current situation is unprecedented. In order to slow the advance of the COVID-19 outbreak, governments are consciously demobilizing whole sections of the capitalist economy. In the US alone, at least 10 million are unemployed. This is coupled with the promise of relief for workers and small businesses and bailouts for big businesses. In the US, the Trump administration has refused to develop a national plan of action and is relying on the states to manage with highly uneven results. There are already shortages of basic protective equipment for healthcare workers across the country, with a catastrophic situation already developing in hospitals. Despite the clear necessity of a drastic response, the entire capitalist class is concerned overwhelmingly with the question of how to maintain profits. A section of the ruling class has publicly announced their willingness to sacrifice the lives of hundreds of thousands by ending the lockdown as soon as possible, with the hope of restoring profitability and normalcy. In this panel discussion, we will examine the roots of this crisis, its social ramifications, and the potential of working class struggle to transform these conditions and forge a path towards socialism. Our panelists today are Blanca Mise, a professor at San Francisco State University and an organizer with Workers' Voice, La Voz de los Trabajadores, and the International Workers' League. Then we'll be hearing from Joe Hutchinson, a hotel worker and member of Unite Here Local 217 and Connecticut Workers' Crisis Response. Heather Bradford, a member of Socialist Resurgence who works full-time at a domestic violence shelter and part-time at a reproductive health clinic. She's active in her union as vice president of AFSCME 3558 and involved with an abortion fundraising group called Hot Dish Militia and a feminist group called Feminist Justice League. Been involved in reproductive justice and healthcare labor working in Chicago. Is an organizer with the Revolutionary Socialist Network in Central Ohio Revolutionary Socialists, a member of Marxist Center and an essential worker. And Justin Akers-Chacon is an activist, professor of U.S. history and Chicano studies, and writer in the San Diego-Tijuana border region. He's the author of Radicals in the Barrio and No One is Illegal, Fighting Racism and State Violence on the U.S.-Mexico Border, and a contributor to Punto Rojo magazine. So panelists will have 10 minutes to speak, and I'll hold up a 2-minute warning sign to let them know when it's time to wrap up. If anyone has questions for our panelists, you can use the Q&A tool or the chat on the side of your screen. You can also post questions in the Facebook comments, and we'll have the question and answer after each panelist speaks. So we're going to start with Blanca Mise.
Hello, thank you so much to all the attendees and the people who are assisting to this webinar. We've been asked to speak about several topics, and so I'm going to try to cover them all. The first thing is the discussion about how this pandemic is affecting disproportionately, of course, working class people, but also people of color and women. And I know the rest of the panelists are going to cover that in a more detailed way, but it's very clear for us, right, that this crisis is not affecting everybody the same way, that rich people have their private healthcare, that they have their residence, that they have money, and that working class people are the ones paying the high toll of this crisis. And among working class people, we know that the essential workers, who are the ones who are putting their life at risk every day without the basic PPE to go to work, without the basic health protections and safety protections, are also gendered as a gender working class, because we know the healthcare industry is mostly women. And there's also like a working class of color, because grocery workers, transit workers, food workers are workers of color. Many are immigrants and they don't have a legal status. We also know that the system of mass incarceration in this country that has a high proportion of Black and brown people in jails is putting their lives at risk. And I know some of our colleagues and comrades here are going to speak about this, but we can just mention the Chicago County Jail, which has a very big outbreak right now of a coronavirus infection with more than 250 people infected and several deaths. And we also have the situation of homeless folks, homeless people who are also Black and brown people. Here in San Francisco, for example, there is now a break in one of the homeless shelters. And in 3 days, we went from 5 infections to 70 infections. And we can see that many of these folks are gonna die because we don't have adequate housing and we don't have healthcare for everybody. And I could go on. I mean, I know maybe surely Justin is gonna talk about the situation of the more than 33,000 immigrants who are held in detention centers, who are also seeing outbreaks. And also, I wanted to make a mention about the situation of women during confinement. We know in China, during the period of confinement in the Hubei province, the reports to the police about domestic violence and abuse tripled during this period. So what this crisis is doing is showing the problems of capitalism and who always pays the crisis: working people of color, and women. And I don't want to end this little report without talking about the situation internationally, because we know the US is an imperialist country and is also benefiting from this crisis, right? They're fighting in the market to buy masks, to buy respirators. They're leaving other countries without resources. They are enforcing economic sanctions on other countries. And I was listening to the BBC this morning, and Iran is already asking workers to go back to work because the sanctions the US has on the Iranian economy is increasing the number of deaths daily in that country. So one of the questions we have right now is, what are we going to do about it? And what is the government going to do about it? And as Erica said, many of us socialists are saying that the bailout program, which has been presented as a bailout for all, is actually a bailout for the corporations. And despite the way this bailout is being marketed, right, saying that they're giving equal amount to workers and equal amount to big corporations, that is not true at all. 17 times more money is going to big corporations than to working people, because many of this money is getting, more than 600 billion is given to the Federal Reserve that will become 4 trillion loans, additional loans to corporations. And working people are getting a one-time paycheck, a very small subsidy for unemployment, and that's it. And so in face of that, and I invite everybody to go to our website and check out our program, our socialist program of relief, because we're calling for the need to have universal paid sick leave for everybody, to increase the pay of workers that are putting their life at risk, to keep the confinement until we have security that we can go back to work, to retool all of our industry and put our industry, our infrastructure to serve people's needs and stop serving profit, right? And we also are calling for the end of all evictions, the end of deportations, and something that is very important, to give legalization to all immigrants so they can have access to basic healthcare and basic needs. This is not impossible. This is what Portugal just did. So all immigrants living in the country can have adequate healthcare. And I could go on and on, but I think the question of stopping the US sanctions to any country right now is urgent. And also it's urgent to cancel the foreign debt of all of these countries, because we know many of the countries are relying, most of the money they make, they need to pay the interest of these loans. And instead of paying the interest of the loans to the IMF, to the European banks, to the American banks, they should be using this money to attend to the needs of the population. The last thing I will talk about is what are we doing and what we should do. And one of the reasons we're having this webinar today is that we believe that activists, union organizers, community organizers, radicals, socialists, we need to come together in this moment of crisis to build a united working class response. We call it a united front of workers. A united front of workers, of unions, of organizations, united around a program for basic demands, emergency demands that meet our needs. And the most important thing is that the only way we're going to get this is by organizing and fighting and taking action. So for us, we need to build a united front for action. And we have a program of socialists, but we will do a united front around basic minimum demands, a combination of minimum demands or socialism. And the most important thing is that we start building it now. For example, here in California, where our party is active, mainly in the education sector, right? And also transit workers and housing struggles, we are active in the higher education network that regroups activists from 6 locals of universities here in the Bay Area, and also in California Educators United, which is a network of rank and file activists in different unions. And we have like core and caucuses in different unions in the Bay Area, in San Francisco, in Oakland, in Berkeley. We have comrades in Hayward. We're trying to bring our unions together to fight back against this and try to connect our local issues, our sector issues with broader issues of us as a class, because unless we unite, and we have seen how this crisis is affecting us in a disproportionate way, unless we unite, we're not gonna be able to get out of this. And we know that right now we have a few initiatives that are coming out, right? We have next week, there is gonna be a National Day of Action to support the nurses. Labor Notes is calling for this. Many nurses unions are calling for this. I think we need to see how we can participate. We know we have heard about calls about an action on International Workers' Day, May Day. And that's an important action because the government right now is saying that they want us to go back to work on May 1st. And we need to say we will not gonna go back to work until our needs are met. And we will go back to work to meet our needs, not to make profits, right? So this call for May Day action has been put out by Corporation Jackson. And I think like all of these calls for action, the most important thing is to see if we can connect them to rank and file organizing to give some substance to this call and see who can go out and take action together in this country. I think this is a moment for us to come together as socialists, come together as activists, and do it in a way where we are not just passing resolutions or making grand statements, where we're reconnecting with our base. I know it's very difficult to organize in times of confinement, but in my union, it's been very successful to hold organizing meetings via Zoom. We have had a lot of participation. We are doing surveys, we're doing online actions, we're checking in with everybody, we're making sure people have sick leave, we're making sure we're gonna protect their jobs, and we know it's gonna be a struggle. So the last thing I want to say, this is the first of many webinars we're gonna do, but we need to prepare ourselves for a long-term fight. This is about COVID, but it's also a crisis of capitalism, a recession is coming, and this is an historical moment for working people in this country and in the world to fight back against capitalism. And in this context, we think that us as revolutionary socialists, we have a key role to play. So I'm very happy we're coming together to do this webinar, and I'm really looking forward to hearing what my comrades have to say here and what people who are connected want to say. Thank you very much.
Great, thank you so much. Our next speaker is going to be Joe Hutchinson.
Thank you. I'm a hotel worker in Stamford, Connecticut, local 217 Unite here. We've also recently been working on a project of trying to unite unions, rank and file workers, giving a real voice to rank and file workers, called the Connecticut Workers Crisis Response. You may have seen the statement we've recently put out circulating around. I'm going to talk about that in a minute. The way I'm kind of structure my talk is I want to talk a little bit about the hospitality industry that we're involved in, that I'm involved in. Then I'm going to talk about, what does the current crisis show us? And then I want to, discuss, the response that we have from the Connecticut Workers Crisis Response. And then what is the way forward for the working class in the United States? So in our industry, for those who might not know, our union in particular, Unite Here, organizes 300,000 workers, and 90% of those workers have now been laid off. And the majority, are women, Black, Latino, from different oppressed or immigrant backgrounds. And across the country, every local, including my local, is really scrambling to negotiate the impact of all of these shutdowns with companies, trying to make sure we, maintain healthcare. From me, myself, I'm laid off. The company cut our healthcare on March 31st for anybody who was laid off. And a lot of us still haven't received unemployment benefits. And every day, just as Blanca had said, we're, running around trying to check in, with people, make sure that they're at least set up to receive the benefits, trying to find out what's going on. And I think one of the things that we need to start thinking about is how do we put, part of the CWCR, the idea behind it is to find a way to put pressure on the government to, release these funds. Our industry is one of the largest hit in terms of the layoffs, and it ranges from everybody from hotels to casinos to professional stadiums and airline workers. And going into this year, the idea was to begin a 5-year plan of organizing 100,000 new workers into the union across the country. And that, I think, is shown to be even more vital, along with the fight around the airlines to increase wages and healthcare for food services in the airlines. And those fights, I think, are now shown to be even more essential, especially in terms of organizing the South and bringing more workers into the labor movement. So one of the big downfalls, and I'm going to talk a little bit more about this later too, one of the big downfalls of our union, though, is a reliance on the Democratic Party. We've put forward these good demands for what workers need to get through this crisis, but the continued, reliance on the Democratic Party creates, I think, a big problem, a disconnect when you see the type of legislation that's actually being passed that Blanca had described that doesn't actually give workers the type of relief we need. It's part of the reason why we created the program that we did through the Connecticut Workers' Crisis Response. So I think one of the main things that this crisis shows is really the contempt that the ruling class has for workers. And there's just endless examples of this. We're right near New York City, and one of the first things that comes to mind is the transit workers, where now more than 50 transit workers have died, continually being sent out into, situations that are incredibly unsafe health and work conditions where, they're being exposed to COVID-19 on a daily basis. And the obvious other one is the nurses. There's been some really dynamic struggles nurses in New York City. In Connecticut here, at Waterbury Hospital, they're having trouble just getting regular testing for people who have been exposed. These are, trouble getting testing for nurses who have been exposed to COVID-19. But then when you look on a international scale and you see the videos of bodies in Ecuador and people scrambling for food in Bolivia and so on, you just see the real contempt that the ruling elite have for workers going through this crisis. They're having the mass burials in New York City on Hart Island. As Blanca spoke about, the disproportionate effect that it's having on communities of color. Even the field hospitals that are set up in New York City are being run by anti-LGBTQIA groups, and we're needing to push back against that as well. One of the hopeful signs through this, though, in this crisis is I think what we can derive from these wildcat strikes that are going on and these initial militancy seen from the Amazon workers and Target workers. And, right before the crisis, into the crisis, the University of California wildcat strikes that were going on that were leading up to this. And I think it signals a very new and militant direction of this movement. But the question is, how do we take it from wildcat strikes to really more sustained mobilizations, to actually win the demands that we need? Non-union workers are fighting collectively, and the masses of workers are figuring out that withdrawing their labor actually gets results. And this is really important because that conclusion is going to, point us in the direction forward, in the coming months and even years, because Blanca's right. This is not a short-term crisis. This is a crisis, a medical crisis, an economic crisis, into a recession, into a potential second outbreak. and so on and so on. And workers are going to have to be prepared for the long term. And this is a discussion we're having every time we meet with the Connecticut Workers Crisis Response, because we can't just get settled into the fact that this is going to be over in a few months. That's wishful thinking. The impact of this is going to last, and we need to be prepared. We need to start getting prepared now for these battles ahead. And one of the main reasons why we formed the Connecticut Workers Crisis Response, which was a bunch of us hotel workers initially signed on, some cafeteria workers, some teachers, stop and shop workers who had just been through the strike last year, who were really activated around this. Right today now we have the statement going around with, I think getting closer to 200 signatures, and representing like 19 or 20 different unions, and then also signing on unemployed workers. And what we really wanted to do was, we weren't looking at this as setting up an oppositional force to the labor movement, to the AFL-CIO in Connecticut. We want to collaborate with everybody. We want to put all of the labor movement into motion to fight against this crisis. And to do that, we didn't, as rank and file workers, we didn't want to be passive participants in it. We didn't want to just sit back and let someone else handle it. We had ideas and thoughts, and we know what workers need on the ground, because we're going through it, whether we're still at work or we're laid off or completely unemployed or whatever. We're going through it. We know what workers actually need. So our platform that we created has 5 main points. One, for workers who remain on the job, talking about protective gear, talking about testing, talking about childcare for these workers. 2, the economic protections for workers and retired people, so that anybody who's going through this crisis isn't being hit incredibly hard and wiped out, and actually can come out economically okay. And I encourage people to go to the Connecticut Workers Crisis Response on Facebook and read the whole statement. Maybe we could share it in the chat. So the third part is protection for workers' rights and civil rights. This is including the right to strike. The GE workers who went out, now in 4 states, Texas, Virginia, Massachusetts, and New York, demanding that instead of making jet engines, they make ventilators, is I think the exact direction we need to go in. And if it needs to be a strike that gets them to make that decision, then a strike, and especially a time of crisis, is vital for workers, for health, safety, and obviously putting forward a vision for creating the things that we need in society to get through this. And also defending the civil rights of Black, Latino workers who are disproportionately affected. The bread lines around the corner from us are incredibly long, and it's majority Latino and immigrant workers. And then also, obviously, stopping attacks against Asian workers from scapegoating on this, LGBTQIA workers, as I had mentioned before, and so on. 4, we need an emergency reorganization of society and the priority measures, which includes things like appropriating hotels. We would love take our hotels, use them as field hospitals, use them to house the homeless, use them to house the, first evacuate the jails and use them to house incarcerated people who might not have a place to live. Use them for LGBTQIA youth who are facing discrimination at home. Use them for domestic abuse, and take our hotels or unused housing, appropriate them, and use them for these things. We need that type of reorganization of society, and even more so in terms of industry, creating the ventilators and protective gear that we need. So I'm going to just wrap up. And 5, how are we going to pay for all of these measures? Taxing the rich is obviously number one, and then we can easily turn around this situation by increasing these taxes on the rich to pay for this crisis. So then finally, one way forward for working people, and you have people like Dee Taylor, who's the international president of Unite Here, or Sarah Nelson, who's the president of the flight attendants, and they say really good things, but I think in the unions, socialists need to pressure the union leadership and in terms of putting forward an example, calling for what would now be an online Congress of Labor to immediately discuss the type of program that we've put together in Connecticut, but on a national level. And you could see what the power of labor is from the last time the government threatened to shut down, when Sarah Nelson threatened to call a general strike of flight attendants, and the air traffic controllers called out, we're doing sick outs, and essentially shutting down air traffic. And that had a really resounding effect in terms of moving the government shutdown into a place where there was some resolution for workers. Now, if they took that and channeled that energy towards calling for this online Congress of Labor, that was not just the top union bureaucrats, but also represented the rank and file workers whose voice desperately needs to be heard through this crisis, we would be able to construct and then mobilize the entire working class to fight for these demands. There may be 6.6 million people out of work, but there's sure a hell of a lot of people still on the job who we can shut down the country, shut down the rest of the economy, and win every demand that we need. And this is the direction that workers need to be thinking in. And in order to achieve that, because there is such a high level of unemployment, we need to organize all of the unemployed workers like they did in the 1930s. A mass, robust program to organize unemployed workers to join in the fight in order to win the economic demands and health and safety demands that we need is extremely important. Health and safety committees on every workshop floor that's going right now. We need to organize the millions of unorganized workers. And I'll stop here by saying, ultimately, we need to break with the Democratic Party and build an independent labor party that's rooted in this new rank and file, renewed fighting democratic labor movement. And if we do that, then that's going to put us into a place from going on the defensive to the offensive, and we can actually win all the demands that we want.
Thank you so much, Joe. So next we have Heather.
Hi, so my name is Heather Bradford. My talk is going to be a little bit different than the first two. It's more about the social repercussions of COVID-19 on domestic violence. I work at a domestic violence shelter, so I'm just going to speak on that piece in particular. So as Blanca was talking about, there's been an increase in domestic violence all over the world. In China, there's been, reported increase. Australia has seen increases as much as 75%. The largest domestic violence organization in the UK reported 25%. French police reported a 30% increase. I'm trying to think. Although in Italy, like the call volume actually went down after the lockdown. Domestic violence advocates there believe it's because of people being unable to call, and that shelters actually had to deny people going to them because of having to maintain safe conditions during the lockdown for being able to quarantine people. I know that in the US, shelters all over the country have reported increased incidents of domestic violence. In Minnesota, our Day One hotline system, which connects everyone to different shelters, reported a 25% increase of domestic violence calls since we had the stay-at-home order. And our governor reported that 2 out of 3 police calls over last weekend were related to domestic violence. So clearly, all over the world, we have an epidemic of domestic violence going on while we have this pandemic going on. And it's really, it's just a difficult time. In any kind of crisis, like a natural disaster, there tends to be an increase of domestic violence, but this is a really challenging situation because people are isolated at home with their abusers and unable to maybe call out or use a computer or access help for the violence that they're facing. And so that just makes it a particularly hard and challenging time. Just in general, through the history of patriarchy, violence has been used against women and children to enforce that they are like the property of men. So this is, of course, a historical trend, nothing new, but within this crisis in capitalism, people who are vulnerable, like women are, are more vulnerable to domestic violence because of their economic dependence. And also it serves the function of enforcing violently the oppression of women by forcing them to do the unpaid labor, forcing them into like a lower economic role in society, and moving like body autonomy. So it's just a nightmare. And working at a shelter right now is awful. I mean, I don't know of any shelters that have been shut down because they're generally seen as essential services, but a lot of other services have been shut down, such as support groups and transportation and visitation centers, some legal services, things like that. Now, in normal times in capitalism, working at a shelter is a bit like working at a warehouse, and it's a warehouse for trauma and for all the unmet needs of capitalism. So we're really storing people, trying to keep them safe, but they're coming there with trauma, a lot of historical trauma because we work with Native American women, a lot of unmet mental health needs, unmet physical health needs, addiction needs that are unaddressed, just homelessness, needs created by the criminal justice system, which persecutes people of color and poor people, people with disabilities. So it's a warehouse of needs, even in the best of times in capitalism. But now we're in a very, a heightened crisis, and it's just astonishingly difficult because we're working with a population that already has a lot of needs, but then society has shut down its ability to even address these needs at a minimum. So a lot of mental health services, addiction services, health services, just different things, people aren't able to access to the same limited degree that they could before the crisis. And so it's really taxing. It's hard for the residents that are there in this crowded conditions that are unsafe, and even in the best of times are a haven for disease and like skin irritation, scabies, head lice, norovirus. We just had norovirus go through the shelter this week, and so we had residents throwing up and staff out sick, and I myself was sick for 3 days. So even under the best conditions, it's a haven for sickness. It's not a safe place. It's stressful for the residents staying there, and it's extremely stressful for the staff. I was alone for all 4 of my shifts this week, where I have to meet the needs of 40 or more people. We have increased call volume and increased people trying to come to shelter, and it's just really hard. And it's just, and workers are afraid. Workers are getting sick. I mean, I was alone because my coworker was sick. Another coworker sustained burns putting out a fire in the shelter the other week, and I just feel like it's such a good metaphor for what we're doing. Like, this worker got burned on the job because a fire broke out because of someone started it, and we're just putting out fires and getting burned and burned out. And gosh, if I had more time, I wish I could just talk about some of the specific situations related to COVID-19. Like, we had someone come in who her abuser said he had COVID-19 to try to lure her to come back to him. We had another person who was a high-risk pregnancy, sleeping in her car, homeless, had fled her abuser, but was told by the police because of the stay-at-home order she could not stay in her car. She had to find shelter. We were the only shelter in the state accepting people, so she had to drive like several hours on almost an empty tank of gas to get to our shelter. We had another person who got choked. She was told by the ER that she couldn't come in for that because it wasn't a high level emergency enough, because they wanted to limit resources. And another person who had to spend the night in the bathroom because with the door locked because she couldn't get away from her abuser. So very like, so this crisis is creating a bigger crisis, you know, and it's enormously challenging as far as any like demands of like workers could do, or like I think what Joe had mentioned, taking over hotels so that these people, that residents can space out and not have to be crowded. Trying to mobilize some people that maybe lost their jobs within the field of domestic violence into doing shelter work so that we're not short-staffed like we were this week. Funding is another thing. Most shelters are nonprofits. We get our money from some donations, from grants, but it's not a stable like flow of funding. So we need to have stable government funding to make sure that we can function and function at a high level. We need to make sure that we have basic protective equipment for staff, such as masks and gloves, but also for residents that are, you know, confined to rooms with several other people. Hazard pay, you know, I mean, it's a very hazardous environment. We're all sort of resigned to the fact that we're probably going to have an outbreak and we're probably going to get sick because there's no way of controlling it. And a lot, like I'm fortunate that my nonprofit domestic violence shelter is unionized, but that's not the norm. So expanding the unionization of domestic violence shelters. And I know I'm pretty much out of time, so I think I'll leave it at that, but that at least should give an overview of the state of domestic violence right now and what that means for workers.
Thanks, Heather. Now we have Mary.
Hi, everybody. I'm Mary Bowman. I'm a nurse practitioner here in Chicago. I'm an abortion provider and I do outpatient sexual and reproductive health. I made a PowerPoint. I hope you don't hate it or hate me for making it, but I think it is helpful. I'm going to go over just some basics about the way that COVID is distributed in the United States, and then I'm going to talk specifically about abortion. I don't have a PowerPoint for the abortion stuff, but I do have an article. So here is the PowerPoint. All right, so when we think about the distribution of COVID across the United States, Blanca had referenced Cook County Jail as a hotspot. And in fact, it's not just a hotspot, it's the largest cluster of COVID cases in the United States. So currently we have over 300 cases. In Cook County Jail. It is a 96-acre jail on the southwest side of Chicago. There are 5,500 inmates there. And just as a reminder to people, jail, as opposed to prison, jail is where people are held before they are sentenced. So this means that we have over 5,000 people in the city of Chicago are being held in Cook County Jail who haven't had a trial yet. I worked there for a brief time as a nursing student, and some people are held there for years before their trial. So we're seeing this in jails and prisons across the country, but jail specifically, we see, you know, in New York City, people, the first 2 deaths in Rikers, which is also a jail, were people who were arrested on total bullshit charges who should not have been in jail at all. And I mean, many of us would argue that there should not be jails, but this is really amplifying the need for that change. I have a little quote there from the sheriff's office. They also think that they are underrepresenting how many cases are at Cook County because they're actually not testing people. And so again, we have to think about, my partner's delivering me some food. Thanks, Brian. But we have to think about the fact that we aren't testing people. We aren't testing people in jail, but we also aren't testing people even in healthcare. So my friends who work at the University of Illinois at Chicago, a large public hospital in Chicago, none of the nurses are being tested who are symptomatic. They're just presumed positive cases. They're not actually getting tested. So it's not just like, oh, the inmates are being neglected, which for sure they are, but nurses even. And a beautiful thing that happened, National Nurses United, the largest nurse union in the country, their organization here in Chicago was organizing to try to have inmates released. So it's one of the many beautiful examples of how there's a lot of cross-discipline solidarity happening, and we can do more around that when we organize. I want to kind of zoom in a little bit on Louisiana, and I saw in the chat that there are some folks in the audience who are from Louisiana, and so maybe you can speak to this a little bit more. But I think it's something that's been a little bit underrepresented. So what I think is very interesting is Louisiana has a 10th of the population of California and the same number of cases of COVID. And so there are 18,000 cases of like confirmed positives in Louisiana. That's the same number as in California. They track it back to Mardi Gras, which is not surprising. 1 million people travel to Louisiana for Mardi Gras, but it's not just the people who traveled, right? It's in citizens of Louisiana, right, are testing positive. There's also a number of known clusters in nursing homes. And there are so many healthcare issues and ethical issues around nursing homes in the United States that are definitely worth talking about, and I'll get into that a little bit. But we're noticing, like, that was the other largest cluster in the state of Washington, where arguably in the United States, Washington state was one of the worst hit and the soonest. So we're seeing these clusters in nursing homes, which begs the question of why nursing homes, right? And then of course in Louisiana, one of the most famous prisons in the country is there, Angola, which is famous because the conditions under which inmates are held are so egregious that there have been many civil rights cases there, and many strikes of jail workers, or prison workers rather. And so Louisiana has the highest incarceration rate in the United States. 65% of the inmates in jails and prisons are Black, and at least 28 people who are incarcerated and 22 corrections staff have tested positive in Louisiana. So something to consider, and this, I just pulled this map from the CDC like a couple hours ago, so it's very current. So let's talk about care workers. So when we're thinking about who's being impacted from a worker perspective, of course, there's a lot of press about nurses and doctors, especially people who work in critical care like ICUs, which is 100% the case, right? That, people on ventilators have to get put on ventilators. So the people who put you on a ventilator are at the highest risk for getting aerosolized virus in their faces, right? And so it's very dangerous. A number of critical care workers have died. I think as of April 1st, what was it? I think Medscape had compiled a list of over 100 healthcare workers across the globe who have died from COVID, and the majority of them are critical care workers. But what we see in care workers as well, not just speaking about registered nurses or doctors, is that there's an immense disparity in terms of gender, in terms of race, and in terms of documentation status for people doing direct care. And we've talked a lot about hospitals and nurses and critical care because that's where we have a lot of known positive cases. But there have been a lot of interesting and devastating studies that have come out in countries where they've hit the peak and it's come down, and so they're starting to study things. I think in France, their death toll jumped 40% when they added people who had died at home. And so when we look at care workers, we also have to look at home health aides, people who make less than minimum wage often and are mostly Black and brown cisgender women. We have to look at nursing assistants who majority of the care staff, direct care staff in nursing homes are nursing assistants. So low wage, high skill work. And these are the individuals who absolutely have never had adequate PPE, whether it's during a pandemic or in quote unquote normal circumstances. And so we really have to shine a light on those care workers, as well as the doctors and nurses who are using their position of sort of like media attention to amplify the need in hospitals, which is true. But then we have to talk about, so nurses are getting hazard pay, doctors are getting hazard pay. What about the janitors of the hospitals? What about the nursing assistants in the hospitals? What about home health aides who already can't even, they've been fighting to even be able to unionize, you know, over the last 10 years. And so we have a huge disparity when it comes to direct care workers. And these folks are the people who are already making less than minimum wage. They're not making nursing or doctor salaries. And they are also the people who are more than likely going to be heavily affected. Oh my gosh, I have 2 minutes. So I want to talk to you about the racial disparities across the country. So here in Chicago, 70% of the people who have died have been Black. In Louisiana, 70% of the people who have died have been Black. 100% of the people who have died in St. Louis have been Black. That is just 12 cases, but that tells you something about how the disease, how the virus is dispersed. In the CDC, we're fighting them to publish their data and to start tracking race in terms of who's dying. And so when we talk about class as well, like who has to keep working, who has to go to work, right? Who's essential but can't work from home, who has to take public transit, who has to drive the taxis and the trains. We see a lot of really beautiful worker movements developing: wildcat strikes, union workers, grocery and delivery workers, transit workers. It's all very fantastic. But let me talk a little bit about abortion now, since I have 2 minutes. So the situation with abortion, obviously in the United States, has been abysmal for a long time, and it's no less abysmal currently under lockdown, right? So a number of states, I just looked it up, and at this point we're at 13 states have restricted abortion specifically through the reduction of non-essential services in the United States. And so that is likely going to get worse, and they're likely going to try to make these temporary bans and restrictions permanent after the crisis. So when we think about the kind of movements that we need right now, we need healthcare workers organizing their workplaces, and that includes people who are home health aides, that includes people who are certified nursing assistants. We need healthcare workers who are in the public eye right now to advocate and uplift the stories of these individuals who cannot get on camera, right? We need people to fight for abortion. We can't have these temporary bans become permanent. We have to resist them. We have to speak out against them. I'll share a link to an article that I don't know who wrote it, possibly someone I know, possibly sitting in this room with me. But I'll share that article for you guys to look at, since I don't have a lot of time to talk more about abortion. But the very last thing that I wanted to talk about, which I think a lot of people aren't talking about, is the need for childcare, right? And so we're seeing right now that all these public schools are closed. Good, they need to be. That's how we're gonna flatten the curve, right? But that means that there's a childcare crisis for workers, even essential workers. So where I work, there are, the majority of my clinic staff who aren't doctors and nurses are Black and brown mothers, and their children aren't in school right now. And so how are they going to work 10-hour shifts at my healthcare center when no one's home with their kids? So this is also revealing this fundamental need for social reproduction under capitalism that is largely invisible, largely unpaid domestic labor done primarily by cisgender women and transgender individuals. And so when we talk about the movements that we need to build to advance the world that we are dreaming of under this crisis, we have to include people who've been invisible. We have to talk about domestic labor. We have to talk about childcare for all, universal childcare as a twin demand with universal universal health care, right? Because if we don't have universal childcare and we don't have public education, which they're certainly attacking, right? What happens? What happens to those individuals? Women stop working outside of the home, right? And so we can't let them roll these things back under the guise of this crisis. We are stronger than them. We are many and they are few, and we can win.
Great, thank you so much, Mary. Next, we're going to hear from Coco.
Hey, comrades, can you hear me?
Yes.
Okay. So I'm going to start off just talking about myself and my job, and then trying to zoom out extremely far to the world condition, and then hopefully get to some practical conclusions. Might have to cut the practical conclusions because I'm pretty long-winded generally, but yeah, first off, I'm Coco. I'm part of the Revolutionary Socialist Network and Central Ohio Revolutionary Socialist. I'm a grocery worker, and I work the night shift. So yeah, the first thing I'd like to talk about is the conditions in my workplace. When the epidemic started, my managers kind of acted like nothing was happening. Like the first time anyone even mentioned anything about the coronavirus at work was a week and a half after it got really bad in the United States. And what my manager said was he basically just said a joke making fun of all the people stocking up on toilet paper, that kind of thing. But for literally 2 weeks, there were no changes whatsoever in my workplace. So we weren't provided gloves, we weren't provided any sort of sanitation, any protective equipment. And oh yeah, there was one other thing that they changed in the first 2 weeks, and that was that they asked us all to take on overtime. So I talked to one coworker who had been working after the 2 weeks every single day since the crisis really got bad here. But after 2 weeks, things started getting slightly better. I mean, they started providing latex gloves to all the workers and allowing time for hand washing and that kind of thing. They also gave us a $2 an hour raise, which, given the healthcare that we have and the conditions of the workplace, given that it's probably one of the most likely places outside hospitals, jails, etc., that you might be able to get it. It's like $2 an hour. If I get it, then I'm economically destroyed. So I'm glad that we got $2 an hour, but it still seems a bit insulting given we're barely compensated anyway. But one other change that's been made that I think has been great is that it's become a lot easier to actually organize in the workplace. I've been working at this workplace for about 4 months and just trying to establish decent relationships with my coworkers. We don't have a union, so I've just had more informal conversations with people. And ever since this epidemic started, there's been a huge, I'd say a huge politicization in the workplace about like, we need safe conditions, we need better pay for this, etc. So there still isn't much in the way of concrete organization, but I think the tendency is definitely there. And I don't think my workplace is unique in that sense. So I'm going to zoom out extremely far outside my personal experience and get to some of the overall conditions that I think are determining how we experience this crisis as workers. So it's a cliche, but I'd like to really start with the 2008 financial crisis. Really, the whole period we've been living in is, I would say, in the period of the 2008 economic crisis, because that crisis has shaped the economic, political, and order for labor that we've been existing under since then, and that's been an order of continued, ramped up austerity, ramped up neoliberalism, and ramped up attacks on workers. At the same time, there's been a resurgence of a labor movement, a resurgence of social movements, and a resurgence of an explicitly self-identified left. So we see this sort of contradiction playing out across the world since the 2008 financial crisis of a huge political polarization, with the forces of the neoliberal center and the establishment losing ground. So including in the US, in India, in many countries across Europe and across the world, there's been a strengthening of far-right politics, including economic nationalism and racist dog whistling, anti-Semitism, sexism, you name it, all of the oppressions. And that's been one response to the problems of neoliberalism, is to turn to a sort of economic nationalism and increasing attacks on the working class. And there's also been the rise of left movements, which have been far weaker than the far right, given that the left is actually fighting against the establishment rather than one option that the ruling class picks to get out of a crisis. But we have seen it. So in the United States, we've seen the huge growth of socialist organizations. We've seen a huge strike wave, especially among teachers and nurses, et cetera. And these are some of the conditions that we're living in subjectively, is that in the 2008 financial crisis, there was certainly political struggle after it, like Occupy Wall Street. A number of movements could be said to be direct sort of products of 2008. But today, the political consciousness that exists during this crisis, I would say, is far higher, and the yearning for organization and to fight against these capitalist attacks is much higher than it's been in decades, because of these rolling crises and the increasing proof that the only way that we can win protections and win better rights for ourselves as workers is through struggle, whether in the workplace, in social movements, in our communities, etc. So to get, to talk about the character of this crisis, we're experiencing a health crisis, and that's a drastic health crisis. Millions of people worldwide could die, and I don't think we should downplay the significance of that at all. But at the same time, the coronavirus has produced an economic and political crisis for capitalism that I think is going to shape a whole new period, such that instead of being in the period of 2008, we'll be in the period of 2020 and on. These are the conditions that are going to shape the next decade, the next 2 decades. And I think we need to start preparing for that. So the reason I say that is because this economic crisis produced by a reflection of the coronavirus, it's not going away. On the one hand, it's like production has been restricted significantly. It's also demonstrated the contradictions that were already existing within the economics of the capitalist states, and exposed its weaknesses. There have been falls in the stock market, and the state of the working class right now is extremely precarious. We've seen millions of people laid off their jobs or functionally laid off their jobs because of this crisis, and unemployment registration has gotten extremely difficult. So tens of millions of people in this country alone are facing existentially threatening conditions. So that's creating contradictory impacts. On the one hand, all the unemployed workers currently have less power than they did previously because they can't intervene in their workplace. They can't fight back directly against these conditions. So I think we need to strive to build organizations which can include unemployed workers and fight for their rights, whether that's the provision of necessary goods, wages, etc., but also fighting for their basic rights. We also need to look to connect with this radicalization in the workplace, fight for safety, fight for better wages, fight for disaster pay, fight for healthcare. And these aren't unreachable goals. I think more than any time in my lifetime, for sure, there is that desire to fight. So I'll end on just saying that what we do now is going to shape the nature of this period. It's not just the ruling class. It's not just Trump. It's not just all these capitalist pigs that are going to produce the society that we come into in the next years. If we struggle, if we fight in an organized fashion against these capitalist attacks, we can turn things around and actually fight finally until we win socialism. So we should look to things like the movement for a rent strike, the movement in the workplaces for safety, movements trying to fight against prisons and fight against the concentration camps, which have become death camps for tens of thousands, hundreds of thousands of oppressed people in this country. And I think we should set our sights really high. I think this crisis exposed more than anything that tepid electoralism and reformism is not going to get us the goods. We actually need to struggle until final victory. So thank you.
Great, thank you. And finally, we'll hear from Justin.
Okay, can you hear me? Okay, great. Buenas tardes, good afternoon, everyone. I'm gonna try to talk quick because I have 10 minutes. I wanna focus on how the economic crisis and pandemic are impacting countries through the framework of the global imperialist framework. The worst of the pandemic and crisis are just now affecting poor, oppressed, colonial and semi-colonial nations. I'm going to refer to these as low and middle income nations for the rest of my talk. Furthermore, many of the poorest nations have already been in different stages of economic crisis and haven't recovered from the last crisis 10 years ago. As the US and European Union, I will argue those responsible for constructing the architecture of the neoliberal financial capitalist system, as they spiral into depression and bail themselves out, they basically are leaving the rest of the world behind. And in fact, they will soon be moving to make poor nations pay for the crisis through more IMF-administered, austerity-laden debt. They're already scrambling packages to do this as we speak. In other words, there's no solution coming from the capitalist classes of the global 20, of the richest nations. Over the next, the collapse of the restructuring, the collapse and restructuring that we're going to be seeing taking place will immiserate hundreds of millions, if not billions of people in low and middle income countries, in conjunction with what we've heard from our other panelists with poor and working class people in the rich nations. So I want to argue that over the next several years, on one hand, there will be an intensification of the same exact factors that produced the Arab Spring after 2010, all the way up to the spike of revolutionary uprisings that we've seen over the last year. We'll see that. On the other hand, we'll also see an intensification of the factors driving global migration, repression, racism, and xenophobia. So the LMI countries already are facing steep drop-offs that are devastating their weaker economies and less self-sufficient. So many economies that are export-driven, for instance, are seeing a collapse in exports. Tourism, we're seeing massive capital flight from LMI countries. We're seeing the plunging value of national currencies as investors outside their countries and inside their countries convert their holdings into dollars, basically contributing to the lowering of the value of their currencies. Furthermore, the plunge of emerging market currencies against the dollar is sharply increasing the cost of debt servicing. This is creating an immediate and serious threat to financial stability already in dozens of the poorest countries in Africa, Asia, and Latin America. And then we'll see so these countries are already facing economic collapse. We'll see a second wave in the months ahead. Kristalina Georgieva, the managing director of the International Monetary Fund, stated that low and middle income countries may need as much as $2.5 trillion to bail them out, to support them, and that being a low-end estimate. But in response to the crisis, we saw that the rich countries bailed themselves out, and international investors pulled upwards of $95 billion worth of assets, stocks, bonds, etc., out of LMI countries. Just since January 21st, $95 billion have been pulled. This is the largest episode of capital flight ever recorded. Amid the flurry of bailouts of the richest G20 nations, so far, according to the IMF, it's estimated to have reached $5 trillion. The poor and more vulnerable countries have basically been set aside or pushed back. The IMF only recently announced it will provide emergency loans of $50 billion for emerging and poor nations, and will ultimately try to raise $1 trillion from the richest nations, the G20, to fund the loans. But who's going to decide the terms of these loans? Yes, the finance ministers of the G20, and more likely even the smaller, super rich grouping of creditor nations that are part of what's called the Paris Club. They're actually in the process now of determining what these loans will look like. Already over 81 countries have applied for the emergency loans from the IMF, and over 50 coming from the poorest nations and from middle income, what are called emerging nations, according to the IMF. And as the IMF director herself stated, the priority will be preventing these nations not from falling into crisis and collapse, but from falling, quote, into an inability to service their existing debts. Since the Great Recession 10 years ago, the increased financialization of the capitalist imperialist system has created the conditions for an even deeper and more prolonged crisis this time around. And one aspect of it is debt, crushing debt. So since 2009, the massive accumulation of wealth by the richest, by the global investing class, has led to an investment scramble across the globe. Over this same period of time, the richest nations have decreased the amount of what are called concessional loans, meaning loans that basically aren't designed to make huge profits to poor countries. They've decreased grants, etc. And so the overall access to these concessionary loans and grants has been declining. And so LMI nations have been making up the difference, especially the poorest, by basically taking out credit from these international credit markets. And international investors flush with cash, have opened the spigot. They have been so desperate to find new investment returns that they've been shifting to lending to poor and oppressed countries that have historically not had access to these public debt markets. So think about like subprime loans in the housing market. This is what's been going on. As a result of the exponential growth in these credit markets, international debt has skyrocketed overall since the last economic crisis. And this is what's contributing to had been pushing many poor nations into slowing growth or recession before this pandemic even hit. And so there's a host of nations that are facing this severe crisis. And I'll give you an example. In 2019, total global debt topped $255 trillion. That's 40% higher, or $87 trillion higher, than global debt was on the eve of the 2008 financial crisis. And in the decade up to March 2019, the emerging countries, or LMI countries' share of this global debt increased to 31%. Okay. So in reality, many of the poorest nations have never even recovered from the last crisis. And for many, it's actually gotten worse and will get immensely worse. So for instance, over half of the 48 in sub-Saharan Africa, debt has increased across the board, with over half of the 46 nations in sub-Saharan Africa seeing their national debts double or more prior to the pandemic. Okay, I want to talk about two more things quickly because my time is running out. One is austerity and how this is making the crisis worse. Austerity policies tied to debt servicing and restructuring have already been devastating the working class and poor people the world over. Put this into perspective, in 2011, austerity-induced food shortages and rising prices amid a constricted export market contributed to the revolutionary uprisings of the Arab Spring. Once again, prices are rising and international food stocks will diminish, leading to food shortages, perhaps even worse than in 2011, especially in places that are food import dependent, such as the Middle East and North Africa. Over the last year, there's been another wave of international revolt against austerity in countries like Lebanon, Ecuador, Chile, Puerto Rico, and many more. Even though these revolts have subsided, the conditions that produce them will continue and worsen. Latin America is already the world's slowest growing region before the pandemic. 14 Latin American and Caribbean countries are part of the first 80 appealing for emergency relief from the IMF. I want to talk briefly about Ecuador and then conclude with how this is affecting immigration. Ecuador, for instance, is the hardest hit in Latin America. 1 year ago, the working class and indigenous people rose up against the government's plan to force austerity measures that were imposed by a $4.2 billion IMF bailout. The people actually ejected the government out of the capital of Quito through an uprising in the streets. Now, with the pandemic bearing down and oil prices collapsing, the government recently repledged to carry out the austerity requirements dictated by the IMF, even as the infections are spreading and reaching a point where people are having to put the dead bodies of loved ones out in the streets because there's no infrastructure in place to take for the government to pick them up. I wanted to talk about more, but let me just say 15 seconds. Prior to the pandemic crisis, transnational migration was already increasing. By 2019, there were over 270 million people displaced, an increase of 51 million since the last economic crisis. We're going to begin to see increasing dislocation and displacement on an international scale. Already, we see a world transitioning across the world that transition to nations creating refugee camps, border containment zones, immigrant detention complexes, increased walls and barriers. We're going to see an intensification of this process. In the United States, Trump has taken advantage of the circumstances to basically scrap rules that allow refugees, specifically children, to be protected from human trafficking, and other refugee rights rules, basically thrown them all out, closed the border to all refugees, and so far deported over 7,000 migrants out of the United States since the pandemic began. So the crisis of capitalism is creating a worse crisis for people, especially outside the rich nations. It's increasing. It's going to be increasing the conditions leading to migration. We see the growth of, already before the pandemic, far-right parties that are poised to take advantage of these circumstances to build, campaigns around anti-immigration, and we see the rise of the far right. So our response will have to be international. Will have to be one that centers the demands of poor and oppressed countries, and one that also centers the need to position ourselves against the anti-immigrant and the fascist movements that are going to seek to take advantage of it.
Great, thank you so much. So now, thanks to all of our panelists. So now we're going to open up for a question and answer. If you can post your questions in the Q&A section or in the chat. And we have a couple questions that have already come in. The first one, I think Blanca can answer from Steve. What has been the response of unions to pushing for the demands workers need? So far, it seems that unions are mainly publicizing existing resources rather than demanding more. For example, a moratorium on eviction is good, but postpones eviction till later, unless rents are fully waived during the crisis. That's one question. And then someone wants clarity on the statistics that were talked about on domestic violence in Wuhan. If someone can post in the chat what the source was for that. And I think those are our first two. Oh, there's another question on if someone can speak on migrant workers' vulnerability. And we'll start with those.
Should I respond to the union one?
Yeah.
Sure. So, I mean, I agree, and I've been following what many of you have been saying in the chat, and also what Joe said, that we need our unions to break from the Democratic Party. But the question is that to break from the Democratic Party means to rely on the independent action of workers to solve things instead of relying on politicians, right? Is a break to shift the emphasis of power on working class people and the power we have as workers. So right now, my union, for example, is also like initially just said, well, let me share the resources of what's happening. And what we're pushing from below, and we're being successful in some unions, is to say, no, you need to renegotiate our contracts so we meet our needs during this crisis. So it's what is asking for an MOU, a memorandum of understanding, right? So reopen the contract, first to fight for our needs right now. And I think it's very important that all of us who are doing work in the unions, we emphasize rank and file democracy over this process of bargaining, in the process of bargaining. We workers need to have the capacity to gather to discuss what our needs are and frame our demands and force the university to, or the bus or the school or the hospital or the transit agency to meet these needs. And so that's number one thing we need to be doing. We need to be, those of us who have unions and contracts, need to be reopening our contracts to fight for them. But unions cannot stop to fight for themselves. This is an historic moment where unions need to unite to fight with the rest of the labor movement, but also fight for workers who do not have unions, right? And if we just backtrack a little bit, we were in an increase of strikes before the COVID crisis kicked in. We have seen the historic wave of strikes of teachers, right, across the country, especially in right-to-work states. And we also saw an historic wave of strikes in industrialized sectors, like the General Motors strikes was the biggest strike in 30 years against a two-tier system. And then we have COVID, but we have a rank and file militancy in this country. And also we're seeing that with what's happening with the COLA strike, the cost of living adjustment strike at the University of California, that we are supporting and we're active in it, right? And in the same place, we have, again, the same situation. The union leadership wants to stop the movement to make a deal with the boss. And we need to organize workers to overcome that buffer, that obstacle they are, to make the boss give to our demands. And I think that's doable. That requires that we emphasize rank and file organizing, class independence, and mass action and democratic organizing as our method of struggle. It is possible, and this is the moment to do it.
Great, thank you. Does anyone else want to speak on any of those first few questions?
I'll say something. Hutch. Yeah, just to go on what Blanca was saying, you know, I mentioned the call for, you know, a Congress of labor, and that is only going to happen with a tremendous push of the rank and file to push the union leadership into action. I think you have to remember that, you know, as much as it's nice to call for a cleaning of house and to get rid of the, you know, wretched bureaucrats, this sort of thing, there's still, you know, workers in general have illusions in elected leadership. People, you know, more broadly believe that the leadership is going to do the right thing. And so, so just making that call, you know, doesn't always put you in a place to actually win over the, you know, your rank and file coworkers to, you know, to a perspective of action and to actually figuring out how to, you know, mobilize your union into action. And so I think with, you know, it takes a lot. It takes a lot of like basic discussions on a daily basis with your coworkers and putting forward these ideas. Like we brought the statement around to all my coworkers in the hotels, and we you know, no one in the labor movement, you know, leadership is proposing this exact program or such a broad-reaching program, but we brought it to all our rank and file coworkers. The people in you know, in Stop and Shops brought it to their rank and file coworkers. Teachers are bringing it to their rank and file coworkers, and having a very deep discussion about the type of demands we need to place in order to, you know, get what we need. And the next part of that is then trying to mobilize all of this. So and if the union leadership doesn't accept those demands, then you got to keep building, you know, your base in the rank and file. The socialists don't have a mass base in the rank and file of this country, and the rank and file are just starting to wake up. I mean, the teachers strike in West Virginia, rank and file led, started out as a wildcat and then, you know, became a massive strike. You know, was a really good example of that. But yet and then the spread of the teacher strikes, but fundamentally those strikes and the unions didn't break with the Democrats. They didn't take the next step into real class independence and fighting for a class independence perspective. So we're still in that, you know, place where socialists in their unions need to be, you know, winning over and having, you know, discussions on a regular basis with their coworkers to build this broader base that's across the country. And I think, being in the Revolutionary Socialist Network, that's made up of different groupings from around the country, different tendencies even, is a good push in that direction. Because if we orient ourselves as a network to winning this kind of mass base within the rank and file, we can actually push and place real demands on the leaderships of the unions to feel that social pressure, because they're also, susceptible to the social pressure coming up from below them. So I'll stop there, but that's, I think, just one way to think about this.
Great, thanks. We're getting a lot of questions now about organizing in this context and these circumstances. So, for example, hold on one second. Yeah, people are talking about how will we create a mass movement within quarantine, besides refusing to go to work and pay rent? How should the unemployed, what does anyone have any good practical ideas for organizing the unemployed unions for unemployed workers? Someone gave an example of the outdoor relief rights, which fought for expanded benefits, and wondering if there's more examples of lessons or ideas for applying that kind of thinking to today for unemployed workers. And another question in that line is, given the low unionization rate in the US, is the pandemic making it harder to organize the unorganized? What effective tactics have there been for workers without a union to organize and push back? So perhaps, I don't know if there's a panelist who wants to speak to that.
I'll take a couple things. I can't answer all of that, but that's why we have a big panel. So I think there's two things I want to share about organizing right now. As has already been illustrated, healthcare workers resisting on the front lines is an extremely effective tool right now. And so I think as much as possible, not just supporting healthcare workers, but inspiring other healthcare workers to go out on strike or protest. I mean, can you imagine if there was a mass nurses strike right now? If nurses walked off the job? Like, we're so incredibly dependent on healthcare workers' sense of a moral obligation to participate in the pandemic. If we withheld our labor and people weren't getting healthcare that's necessary for life, we could take over the hospitals. So I think that there's a tremendous potential in healthcare worker organizing right now. And the second thing I want to say is I think we would all benefit tremendously from studying the movements of the 1930s and looking at how unemployed folks organized after that crisis. And I think there's a lot that we can learn from like post-war organizing right now too. So if folks have like books or articles or different kinds of movements that you know of, I know John shouted out a couple in the Q&A, but I think that would be really helpful. In terms of organizing unemployed folks, I think we can also learn a tremendous amount from international movements, specifically the Arab Spring. I think we can look at jail and prison organizing. Folks who don't have a lot of ability to directly connect with each other, organizing remotely. So this is not brand new. People have been doing these kinds of movements in the last few years even. So I think we can learn a lot from existing movements.
I could take a stab at a response.
Great. Yeah.
Okay, so yeah, I mean, I think one of the positive phenomenons out of this crisis is the explosion of online organizing. A lot of it not like almost like nothing spontaneous, but with a spontaneity, not connected with particular organizations or anything. So in Columbus, where I live, there's a rent strike group on Facebook, and there's also a mutual aid group on Facebook, and each of those has thousands of members from the community, and those obviously have their problems. There's a lot of mixed ideas and debate going on there, but I think these are some forums that we can intervene in as radicals to try to give a more organized expression and put forward ideas. So I think there's been a lot of good work in both of these groups, like sharing resources in the rent strike group about basically what your rights as a tenant already are, what your landlord can and can't do legally at this point, and trying to create a more coherent response to this, because as other panelists have highlighted, it's like 30% of apartment renters did not pay their rent this month, and we can only expect this to increase as time goes on, and most of this isn't from a political commitment to a rent strike, but because people could not pay. It's like most U.S. Workers don't have enough money saved up to make it to pay their bills without income for over a month. So we need to try to give this a politicized and organized expression that keeps people from being attacked once this crisis is over, individually by their landlords. Yeah, I think there's a real difficulty, especially with unemployed workers, and just the difficulty of not having in-person organizing. We can't do demonstrations. We can't have the same types of meetings, and so much of organizing comes down to these in-person meetings. But I think these kind of Zoom calls are important, and I think one thing that you can definitely look into is joining a socialist organization. There are a lot of socialist organizations doing good work across the country, including a number of socialist organizations represented in this panel. Being part of a socialist organization can help you find places to intervene and can allow you to do political work that you otherwise wouldn't have access to. So for example, my local group, Central Ohio Revolutionary Socialist, is helping a member who's employed in the logistics industry organize their workplace. So 3 of our unemployed members are helping him to draft documents and think through strategy of how to organize there. So yeah, having like a sort of labor solidarity within our organization. And yeah, there are all kinds of social movement organizations also advocating for things like getting people out of the jails and the prisons into safe locations. So I check out the Columbus Freedom Coalition. They had a very important statement about basically giving rights to incarcerated folks so they don't suffer the brunt of this epidemic. But yeah, for those of you who are in the workplace, I think that is one of the greatest places to start socialist organizations. And we need to think through what other kind of forms we can give expression to. And it's really up to us who are concerned with changing the nature of this crisis in favor of the working class that we actually fight this. It's going to be extremely hard, and none of us have prior experience with this kind of organizing, like this extent of online organizing, etc. But we got to make do with what we've got.
Great, thank you. Anyone else want to answer to those questions?
I'll just contribute something. So some people in the chat have been talking about car protests, and I know this has been happening in different parts of the country. I know we're discussing doing one here in the San Diego Tijuana border region. We have a very notorious privately owned for-profit detention center here. So I think it would be great to hear more about how people are using that tactic. I just wanted to share briefly my limited experience organizing during the pandemic. I'm part of the teachers union, which is affiliated with the California Federation of Teachers. And, we've been having union Zoom meetings. Well, we had our first union Zoom meeting this last week. And you know, it was both. It was great to be able to, you know, see my coworkers and especially my union brothers and sisters. But it was also challenging because what the union leadership was presenting to us, and I live in California. This is the Democratic Party. You know, it's a virtual one-party state, and what the union leadership was telling us is that we have to be prepared for double-digit cuts coming in the fall because of the way education budgets are funded. In California, we find out, you know, in the summer how much we're going to get for the following year, and so they're already projecting the largest budget cuts that are going to be implemented since I've been teaching over 15 years. So I had, you know, I often find myself in disagreement with the union leadership and debate them and try to cultivate relations with my coworkers. This is the first time I was able to do it on Zoom, where I, you know, basically argued that we shouldn't accept any budget cuts while, you know, while the capitalist class is getting an unprecedented bailout, and that why we should be arguing for the state to take emergency measures to resolve the educational crisis by redistributing wealth from the rich to the public sector. It opened up an interesting space on Zoom where I was kind of going back and forth with the union president, with an audience of like 120 fellow union members. After you know, after that was cut short, I did have some coworkers contact me after saying they want to talk more about how we can organize against the impending budget cuts. So I think there are no, you know, quick shortcuts in terms of like how we can, or there are very objective limitations for how we can organize under lockdown, under a pandemic, but there are still opportunities. But I think the most significant is beginning to establish or reestablish connections with our coworkers, even by remote. Have these political discussions about what the realities are as we're in recession. We're going to be entering into depression. The IMF calculates that the next year will be one of intense instability. A number of ruling class think tank documents coming out in the last few years, and then two that just came out this year, are looking at significant. They don't use the term class struggle, but they're pointing to significant class struggle as this economic crisis unfolds. So I think beginning to prepare in our own workplaces for the, you know, especially those of us in the public sector, you know, we can begin to lay the groundwork for organizing resistance in the months ahead. And I think, you know, I just wanted to share that that's been my experience.
Great. So we're just going to read one last round of questions, and then panelists will have an opportunity to give summary. Some folks are asking about the formation of independent working class party and what people's ideas are on that. Some folks are asking, we've got a question here, how do we connect the pre-COVID wave of international mass movements and uprisings in Chile, Lebanon, Hong Kong, Colombia, etc., with the current crisis? Can anyone speak to the international implications of this moment? Another question is, how do you expect the political landscape and the landscape of the left in the US to shift as a result of the COVID crisis? What possibilities are opening and closing through this lockdown? What are the strategic and tactical implications for revolutionary socialists? And some people are talking about like wondering if the panelists can address the large gap between what needs to be done in general to respond to this massive crisis and the extremely low level of revolutionary organization in the working class today. In other words, the gap between what needs to be done and the lack of an organization to facilitate it and carry it out. And then one last question here. It says someone from New Orleans is talking about the vast majority of the working class is a very hard-pressed section of the US. Do you support the promotion of people's assemblies? And how do you think socialists should respond to the colossal bottleneck in the distribution of stimulus checks and unemployment benefits? And then finally, a question on surveillance culture. I think that, and the challenges of organizing online. I think that encompasses most of the questions that are left. Does anybody want to take any of those on?
Just a question, is this going to be part of our summary? Are we wrapping up on this last question, or what? Just to be clear.
I had originally thought it was one last round and then summaries, but I'm looking at our time, and perhaps it does make more sense to make the answers part of your summary. What do you all think?
I'm okay with that.
Okay, sounds good. So do you want to start?
Sure. Yeah, I want to speak to the question of the type of party we need, because I think that's, that's like drawing things out to like its logical conclusion, like the deepening of the class struggle. Even The Nation had an article saying like the COVID class war or whatever we're already in. And, in order to actually fight for power, right? Because ultimately the question of like elections is like, who's going to run society? Is it going to be the capitalists, or is it going to be the workers? And and obviously I would hope everybody on this call thinks it should be the working class that should run society, but we need a vehicle to get there. In order to create that, this struggle today can very much put us on that path to creating the type of party we need to make a revolution in this country. I think a great step forward, and taking it from a labor perspective, would be the trade union movement breaking with the Democrats. And I think it's someone in the chat said it's not possible, but I think it is possible. And I think if you go back and look at the 1930s, there was a moment with the rise of the CIO that could have been, and then even before that in the 20s, with the rise of the Farmer Labor Party, there were moments when labor could have broken with the Democratic Party and formed a working class independent Labor Party. And I still actually think that's possible today. And I don't think it needs to be on the scale of a reformist party like they have in Britain. It could take a much more left swing towards and have a full socialist program. But even if it was a reformist party, it would still be a step forward if it was a break with the Democrats. But I don't think it needs to go in that direction. And I think we can fight, especially the socialists who are in the trade unions, can fight for a real labor party with a socialist program. But I think that, we need, if we go back, one of the things that we're thinking about doing is like forming labor party clubs in the unions that can promote this idea. And now, especially when you have a union leadership that's pushing for the Democratic Party, talking about class independence with a group of workers in your trade union would be a really radical departure from the constant barrage of propaganda that you get pushing for the Democratic Party. When I went to the Unite Here convention in Las Vegas this past summer, the whole thing was a pep rally to get ready to push the Democrats into power. The whole strategy of the union in the next period, aside from organizing 100,000 new workers, was to flip red states blue. So the whole, trajectory of the union leadership is along the lines of supporting Democrats. Now, if every socialist and advanced worker in this country that wants to break from the Democrats is in their unions and promoting the idea of class independence and putting forward and have clubs and discussion groups around the idea of building an independent workers' party, that would do a lot to break that stranglehold that leadership has, in the unions around the Democrats. And if you had this type of party, even in a embryonic form, it could have a tremendous impact in the ability to push entire union locals into action, to mobilize workers across the country, and to be able to generalize our experiences which we don't have anymore. You know, there used to be the mass socialist party. There used to be mass workers parties, you know, in the scale of tens of thousands of workers that, you know, could generalize their experiences everywhere. And today we need to get back to that. So I think, you know, in Socialist Resurgence in Connecticut, we are planning on running a candidate this year. And I think it would be great if everybody in the Revolutionary Socialist Network could run candidates in their areas on, you know, really promoting the idea of class independence and the construction of a mass independent workers' party. I think that would do a lot propagandistically to put this idea out there, to popularize it, and to get people fighting for this perspective.
Great, thanks. And now, Blanca, do you want to give your final comments?
I can try, yeah. I'm trying to respond to some of the issues that we've been discussing. The first thing I want to clarify the question about how to work in the unions. We all here agree that the labor leadership and bureaucracy is an obstacle to working class organizing, to independent action. And that's because they have an arrangement with the Democratic Party and with the bosses. I think the question for us is how we organize rank and file workers to take action. Because it's when workers start moving at the rank and file that then the union leadership moves. So I think that it's not contradictory to put our demands on union leadership, what we think they should be doing, and at the same time start organizing for it. What we should never do is put our demands and wait for them to move. We put our demands and we organize workers to go. And we don't wait for them to do things. We believe in the independent capacity of workers to organize, and we need to build a critical mass to do so. And we've been successful in doing that. This is how the COLA strike started in the UC system. It was a wildcat strike that put demands on the union leadership. The union leadership failed to deliver a good contract, and the strike was organized in a democratic way to go to action. The same thing happened when Oakland teachers and Berkeley teachers did their contract negotiations. Negotiations were not moving at the table. The union said, we might do a strike, we will do a strike. And what happened? Wildcat action started. They started in Oakland and they forced the union to accelerate the strike. They started in Berkeley and they forced the union to accelerate the strike, or at least to win better demands. And that's our role as socialists, to organize our co-workers, build caucuses, build core groups, build organizing groups in the union, and give the confidence to workers that when we fight united, the union will have to push for us. And I still want to talk about this gap we've been talking about, what is needed today and what our forces are. I think we as socialists, we need to take initiative where we are, in our unions, in our workplaces when we're not organized, in the communities, but our role is also to connect the militancy of workers everywhere, because workers don't wait for socialists to go and take action. I shared in the chat a map of all the wildcat actions that are happening in this country. So we need to do two things at the same time, right? We need to bring our unions where we're in unions to start taking action, but we also need to start connecting all the other groups of workers that are organizing in their workplaces to do things, and also the unemployed. So we need to do something like Hutch was saying, a Congress of Workers, some sort of coordinating committee, because the first thing we need to do is organize the resistance. We need to organize the resistance, we need to connect it regionally, statewide, nationally, so we have a space for working people, unionized and not unionized, unemployed community, who are fighting, because those are the people who have understood we need to fight, who are already fighting. Those are the sector of the class that are leading. And from there, we need to organize national mobilizations to bring more and more sectors into this movement. That's what we mean by a workers' front of action. And that's what we need to be doing. So sometimes it's leading where we are, but also connecting and going where workers are fighting back, to connect with them, to learn from them, and to connect our struggles, because this is happening. And if we don't amplify it, if we don't publicize when workers are fighting back, this is the mistake we could be making, right? And I just want to say a couple of things about how we start building this independent workers' party. I think it's important to run candidates when we're for elections, like Hutch was saying, but what is more important for us is that any independent party needs to be the organic expression of rank and file struggle. Rank and file struggle that can begin in unions, maybe not in unions, maybe it can be prison strikes, maybe it can be like farm workers. We need to start uniting all of our class. And this would be seen as a legitimate alternative that could defeat the Democratic Party, because we all know that the Democratic Party is the graveyard of any independent workers' action in this country. It will only be able to do so if this is seen as the party that is the organic political expression of all of these movements in this country. So these two things are connected, right? Building or rank and file organizing with building a political expression that is not just saying this is a minimum program, but also we need to bring workers to power. socialism is superior to capitalism. We have a solution to this crisis, and this solution requires us being in power and not the Democrats, not the Republicans, not the Sanders who are linked to the Democrats, right? And I think the left regroupment, the regroupment of socialists, we're gonna find what if we agree when we do these two things together. Do we agree that we need to go into the rank and file and organize? Do we agree that we need to do mass independent action and connect the different sectors of the crowd? Do we believe that we need to have a clear stance against any form of oppression in the class and in our organizing? Do we agree that we need an internationalist perspective to build on what Justin was saying, that we're an imperialist country and we cannot imagine a way out of this crisis just for American workers? It needs to be an international way out. So I think that doing that, and this is why the RSN is so fantastic, we're finding out our common ground and we're inviting everybody that agrees with us to join us. Thank you.
Great, thank you, Blanca. Heather, do you want to give your 5-minute last comments? Oh, Heather, I think you're on mute. I'm so sorry.
Sorry. I guess I could answer one of the questions that came up on the chat box, but I don't know that it was one of the final questions that you had mentioned about the pros and cons of mutual aid right now. So I guess that could be the final question that I try to, or a question I try to tackle. Locally here in Duluth, I'm involved in a group called the Hot Dish Militia. We do fundraising for abortion access. So we provide money to people who are seeking abortion but don't have enough money. So that would be an example. And another example would be there's a mask making brigade trying to create masks for people here who need protective equipment. And I think that the pros is that it meets an immediate need, like people need abortions right now or they need masks right now. A con of that kind of organizing would be it really substitutes individuals for the state, and you have to, keep putting demands upon the state, which involves organizing in the ways that, say, Blanca and Joe had mentioned. So that's definitely a con, is that the state has, so much more production and resources that can be mobilized towards these social problems. And so I worry that mutual aid could get in the way of like that long-term goal, or it has to at least be a part of like mass movement organizing towards that goal. Another thing that I worry about is that sometimes mutual aid individualizes a problem, and it creates like more unpaid labor for women, like who's sewing the masks right now. So I would look at that as an issue with mutual aid, is that we don't want to take on more unpaid labor as a service to capitalism for social reproduction. So I'm sorry that I don't have a grand analysis, but I did want to end at least my piece on domestic violence and care work and the theme of unpaid labor with a poem I wrote. So here's my concluding poem, and it's called Care is a Wall. Care is a wall, a car crash for careers, and a barrier more than a connection. It is blood in the halls, leaky diapers on laps, and urine soaked sheets. It is 1,000 unmet needs that ooze biohazards and suffering from the places quarantined by the state. Care is the work of women with accents and darker complexions. Care is the everyday Chernobyl of tending to capitalism's toxic leftovers, with no evacuation in sight. Care is a wall to fight, storm, or surrender, to die hopelessly against. I hope that a lot of the people doing a lot of care right now aren't going to die hopelessly against the work that they are doing. And I hope that some of the organizing tips that came up in this discussion can help with that, to create a better world for all and a safe world.
Great, thank you so much, Heather. Mary, if you want to give your concluding remarks.
Yeah, thank you, Heather. That was really lovely, and I felt that very very acutely your poem. Yeah, care work is thankless and underpaid, and majority done by women and trans people and Black and brown people and undocumented people in our country. So while I really appreciate all the conversations about long-term organizing strategies within unions, as a person who is not in a union and has gotten fired while union organizing, I want to speak to some of the other strategies that we might need to consider. And again, breaking unions from their dependence on the Democratic Party, I'm all in. I don't see that as the priority at the moment. I think that and perhaps this is just me speaking as a healthcare worker, but what do I think is most urgent right now is the people who are dying. And so I think we need to organize around the intimate, specific, individual, and community impact that this virus is having on people's lives. So we can talk about union organizing strategy all day long, and I want us to, but we have to think about what the priority is for an unemployed person, for a person who's not in a union, for a person who has to go to the hospital for a reason other than COVID. I haven't read the updated data, but at one point the thinking was that 50% of COVID transmission was happening inside hospitals. So we have to talk about healthcare. We have to talk about healthcare, and the majority of healthcare workers in the United States are not unionized, and that is criminal, right? So we could talk about organizing, which I love doing, and let's talk about it. But I think you'll also find, to Heather's point, that the people who are involved in direct care work are often not considering themselves when they are thinking about their work. They're not thinking about themselves as workers, they're thinking about the people that they're taking care of. And that's why our moral obligation to care for others is extremely exploited under a global pandemic, because they know we're gonna keep showing up. They know we're gonna go to clinic. They know we're gonna show up at the hospital because we don't want other people to die. And so the radicalizing moment that we have right now, so many people are being radicalized around rent strikes, so many people are being radicalized around jails and prison abolition, right? Like, it's a beautiful moment. You see these ripple effects of people realizing how destructive and cruel and inhumane capitalism is, and it's fantastic. But what we have to also realize is that healthcare workers are realizing that they are workers in a way that hasn't happened in my career, where they're like, oh, I care about my patients, and I'm down to take care of my patients and do what my patients need, but I'm understanding my own relationship to care work in a different way. I see myself as a tool of social reproduction in the state in a brand new way. And so we have to talk to healthcare workers. We have to organize in hospitals. We have to take this to the people who are directly confronting the illness. And so how do we do that for folks who work in a variety of unions that aren't in healthcare? I mean, we've seen these beautiful, like the GE plant, right? Like they want to make ventilators, they go out on a wildcat. There are these incredible wildcat movements that are happening, not only to protect workers, but to show solidarity with healthcare workers. And that's where I think our priority should be, to show solidarity with healthcare workers. Globally, that has been one of the most effective tools as we talk about COVID. When we see the healthcare workers that are dying because they don't have sufficient protective equipment, when we see internationally in Italy, the workers start to fall, the conditions in the hospitals, wearing trash bags and bandanas in place of sufficient PPE, this is what's going viral. Healthcare workers on the front lines are what's going viral. And so if we miss the opportunity to organize those workers, and if we miss the opportunity opportunity to radicalize individuals around what's happening in a healthcare environment right now, we are not an effective group of organizers, because that is where we need to be. We need to be on the front lines with healthcare workers right now. And healthcare in the United States is one of our most lucrative, profit generating industries. I think it's like our third top I think it's the number one profit generating industry, including pharmaceuticals. And so this is a point of production. It's not just care work, right? It's a point of production and profit. And if we grind it to a halt, then they will not be able to function under the conditions of this crisis. So do not sleep on healthcare workers right now. Not only do we need solidarity because we are dying on the front lines, we need solidarity because we are radicalizing rapidly and we need the left behind us.
Thanks so much, Mary. We have two left. Coco, would you want to give your final statements?
Yeah, sounds good. I just wanted to talk about the Democratic Party for a second. In my view, if we cannot break from the Democratic Party, we should really just give up. The Democratic Party is one of the world's strongest capitalist parties that has the blood of millions of workers and millions of people across the world on its hands. It has carried out innumerable imperialist campaigns. It has carried out racism, sexism, all the forms of oppression. It carries out the exploitation of people, and it represents the capitalist class in this country. So if we can't break from the Democratic Party and build a workers' organization, then we should just give up, because we've already lost. There's no hope for making the Democratic Party a socialist party or something that can actually advocate on behalf of workers. The Democratic Party's social role is to keep workers from building an independent organization, and we shouldn't accept that, and we shouldn't help that on by creating more illusions about the Democratic Party. So while I agree with certain aspects of Bernie's program, for example, I think recent events with his dropping out and endorsing Joe Biden really demonstrate how his vision is still restricted within the Democratic Party, and he's trying to lead his base back into the Democratic Party rather than to form an independent organization that can actually effectively resist this system. It's like he's been a huge advocate for universal health care, which is so clearly needed in this country, especially during a pandemic. And it seems like he's just giving that up. He's like, okay, I'm going to campaign for Joe Biden. And Joe Biden says, you should fucking die, you poor piece of shit. That is what Joe Biden's program is. So I think I had my skepticism about Bernie the whole time, but if that wasn't a betrayal, if his endorsement of Joe Biden wasn't a betrayal, and if his endorsement of Hillary Clinton and the whole party establishment isn't a betrayal, I don't know what is. So what we really need right now is to make these connections between already existing socialist organizations and unorganized socialists. We need to make connections between workers who are organizing in the workplace, workers who are struggling within their unions, people who are struggling on the job, community organizers, and the millions of people who are being radicalized by the conditions of our society but don't know what to do about it. And like building an independent organization and eventually an independent party is one of the most important aspects of that, so that we can centralize all the different work that we're involved in, all these local struggles, so that we can have a apparatus that actually fights on our behalf, in which we can democratically control. We can't control a party that is controlled by capital. Not even behind the scenes, it's just straight up. So yeah, just to get to the broader topic of the coronavirus before I finish, it's like, as I was stating in my presentation, it's like we are coming upon an age of huge disasters and death and destruction. And yeah, honestly, it's hard not to be depressed and afraid of what's going on. But the one thing that gives me hope is that there are people actually looking to change things, and that that's our power. It's like we the working class is the vast majority of the population on the earth, and it has the social power capable of transforming society. And that only becomes clearer during a crisis when our ruling class betrays us and leaves us for dead. So the tasks that we face are extreme, and we're facing issues of existential importance, whether like life or death for millions of people. And that just makes the responsibility on us to get organized and to dedicate ourselves to struggle even more important. I hope that to everyone watching, that we can organize together in the future and build something capable of overturning the society and bringing about communism or workers' control of all of the world. Thanks.
Great, thank you. And finally, Justin.
Yeah, I want to approach this from a position of humility, not try to, in my personal case, present solutions that I think are already proven. But I also feel compelled to try to communicate a sense of urgency that I feel personally overwhelmed by. And I think that urgency compels us, especially in the United States, to build a revolutionary left. And to immerse ourselves in the struggles, however we can, even if it's by remote, but recognize what's coming, and how the next several years, starting with the next several months, are going to be transformative, and try to figure out how we can be a part of that transformation in a way that is liberatory. I think it's urgent because, while I don't want to cast too broad of a net around the left, I think the elections have become very disorienting. Confusion and adaptation, various types of demobilization, I think have weakened us at the time when we need to be the most mobilized and organized. I think that's going to continue. I think that already, because of that, there's been a sort of abdication of a political response and a political analysis to help at least frame as much as we can what we're going through already and what we're going to be going through, in the period to come. The crisis affecting people, the pandemic, is going to be immense. I want to share with you a piece of information I read yesterday. So the pandemic is reaching its sort of first peak in countries like the United States, the richer countries. It's now just really beginning the process of spreading through poor countries. In Africa, there are now emerging clusters of infections in every single one of the 54 countries. And to give you a sense of how bad this could be, because of austerity and systematic underdevelopment through imperialism over decades, the governments there are really in no position to be able to sustain their populations. On the continent, there's an average spending per capita of $12 per person for health services. I mean, you look at the United States, even with our healthcare system the way it is, this private, corporate, for-profit institution, the per capita is still $10,000 per person. So in Sierra Leone, they have one ventilator for 7.5 million people. The Central African Republic has 3 ventilators for 5 million people. Burkina Faso has 11 ventilators for 19 million people. What we're seeing happening in Ecuador right now is going to be spreading in Mexico along our southern border. We're going to see devastation. And the response of, so the political response has to be very clear, that, in terms of being able to point out and organize around, even among small numbers at first, but larger numbers, hopefully over the period of time, that this is the result of the of imperialism. This is the result of the way the international capitalist system has siphoned off wealth from poor countries to rich countries. At the same time, wealth is siphoned off the working class in this country to the rich. So we need to be able to oppose imperialism also in the way that it's going to express itself in a new series of conflicts over the next several years between the United States and China. And the way the United States government is already enabling the rise, enabling, supporting, and facilitating the rise of far-right political parties and fascist movements through the current administration and through efforts made within this sort of global context. We need to be prepared to defend trans-border and migrant people who are going to be the sort of focal point for the far right and xenophobes, especially as we enter into a deeper recession and depression. And then a few more points. In my union, a lot of people are not radicalized. But I think I've been organizing for a while, and I know that I have a number of people that will listen and take into consideration what I say, and in some cases I can shift or change a discussion based on a well thought out participation in a meeting and organizing. I think it's important for us to recognize that there is unevenness in the union. Right now, I probably wouldn't get much traction in terms of, I don't get much traction in terms of arguing for a break with the Democrats. But there are a number of people that are already aware that we're going to be struggling against the Democrats when the budget cuts begin to hit us. And it'll make it much easier as we're organizing against budget cuts to then begin to make a case for what kind of alternative we need. And then, I would just encourage that we think about the importance of building capacity between all of those who want to work together around this project, to learn from each other's experiences, to continue discussions. I mean, we need to think about an ongoing process now of inside unions and outside. And as the previous speaker said, the struggle may emphasize itself more clearly outside the unions than inside. We have to be able to learn and relate to these together, and that would be something I hope to be part of. So thank you.
Great. Big thank you to all of our panelists and our speakers. This was fantastic. So in terms of if you're interested in contacting us, there was a link posted in to sign on to our email list. Again, we're the Revolutionary Socialist Network, and you can find our points of unity and more information about how to get involved, especially to the point that just came up in the chat about building a revolutionary socialist community. This might be a great way to do that. And so please fill out the link, check us out on our website, and thanks for tuning in.